Hi, everyone. I'm Dr. Judy Liu.
And I'm Dr. Priya Koyapalai. We're part of the Canadian Women's Heart Health Alliance and members of Wear Red Canada.
Wear Red Canada is celebrated annually across the country on February 13th to raise awareness about women's heart health. And as part of this year's campaign, we want to share with you 5 key messages. First, did you know heart disease is on the rise and is the leading cause of death for women worldwide? According to the World Health Organization, since 2015, Canada, among other countries, has reported an increase in deaths for women from heart disease.
Here are a few reasons why this could be happening. Heart attack symptoms are not recognized in over 50% of women. And did you know? Women are more likely to present with 3 or more symptoms when having a heart attack. The most common ones being chest pain, pressure, tightness or burning, pain in the jaw, neck, arm, or back, abnormal excessive sweating, shortness of breath and/or stomach pain, discomfort, nausea, or indigestion. Women are also more likely than men to experience the additional symptoms: unusual weakness or fatigue, back, shoulder, or right arm pain, sleep disturbances, dizziness or lightheadedness, and/or a fast or irregular heartbeat. Please get help or medical attention if you think someone is having a heart attack.
The causes of heart disease can be different for women compared to men. Coronary artery disease, which is cholesterol buildup in the blood vessels of the heart. Valvular heart disease, which are diseases that affect the heart valves and cause trouble with blood flow through the heart. And arrhythmia, which is an irregular heartbeat. All of these conditions are common causes of heart disease. Women are more likely to have spontaneous coronary artery dissection or SCAD, which is a tear in the blood vessels of the heart. Coronary vasospasm, which is when the large blood vessels of the heart tighten and squeeze, limiting blood flow to the heart. Microvascular dysfunction, which is when the lining of the small blood vessels of the heart cannot expand normally. Takotsubo, or stress-induced cardiomyopathy, which is when the heart gets weakened after a major stressful event. And peripartum cardiomyopathy, which is when the heart gets weakened in the final months of pregnancy or shortly after the baby is delivered.
What this means is women can be at greater risk for heart disease than men. And Indigenous women in Canada experience increased cardiovascular disease. And South Asian, Afro-Caribbean, Hispanic, and East Asian women have greater rates of cardiovascular risk factors. The following conditions can lead to greater risk of heart disease: certain pregnancy complications like premature birth, diabetes, or hypertension during pregnancy, early menopause, polycystic ovarian syndrome, which is a hormonal disorder that leads to infrequent or prolonged menstrual periods or higher level of male hormones, systemic inflammatory and autoimmune disorders like rheumatoid arthritis and lupus, cigarette smoking, and diabetes.
The good news is that 80% of risk factors for heart and vascular diseases can be prevented. There is a lot that we can all do to help reduce the risk. For example, be active and keep moving. Eat a variety of nutritious foods. Manage your stress. Live free from commercial tobacco and vaping. Limit alcohol and substance misuse. And remember to get regular health checkups.
We want you to be mindful, curious, and proactive in the management of your heart health and wellness.
Because remember, to take care of others, you need to first take care of yourself.
To learn more about the unique aspects of heart disease in women and what you can do, visit wearredcanada.ca or speak with your healthcare provider.
And please join us on February 13th for Wear Red Canada.